So time and time again, we do hear from patients that they wished that their doctors had told them about the foundation and all the support and ongoing support that they received at the foundation. Well, that's precisely what our topic addresses today, and we're going to share information about our awareness program to healthcare professionals called Be the Bridge. We've designed this program to make it as simple as possible for volunteers to inform local healthcare providers of the variety of resources available at the foundation so that they can bridge their patients to the foundation, hence Be the Bridge. Hopefully, many of you have benefited from the foundation programs and services, so it'll be a little bit easier for you to explain to your local healthcare professionals, why it is so important for them to let their future patients know about the foundation. And again, we've made it as simple as possible. We've created educational and promotional materials, which we'll review later in the webinar. But they're materials that you can use for both a quick stop by at your healthcare professionals, or you can do a presentation or a workshop, and we've got materials to support you through that as well. So who are we trying to reach specifically? Well, it could be primary care physicians, it could be nurses, it could be physical therapists, occupational therapists, it could be rehabilitation centers, it could be psychologists. Anybody that has been in your circle of care would be a really good candidate to raise awareness to about the foundation and all the foundation programs. So your next question might be, well, how do I get started? Who do I call? Do I make an appointment? Do I just stop by? How do I really, make this a successful program for myself? Well, you're in luck because Amy has a lot of experience in a variety of medical settings, and she's going to walk us through the best ways to reach the right people in a variety of settings and who you might reach out to. So Amy, I'm going to kick it over to you to get us started.
All right, awesome. Hopefully everybody can see my screen here. So I thought the first place to start naturally would be just where to do this. Where can you be the bridge? And the first logical place that came up to me is going to be hospitals. We know, particularly with GBS, that's the first stop for a lot of people. And a lot of people want to actually go back and, and give something back also. So hospitals are a good first place to start. So we're going to talk about general departments in hospitals. Then I'm going to talk about specific nursing units. Then some other departments you might not have thought about within hospitals, as well as physician practices, long-term acute care hospitals. Some of you may or may not be familiar with those. They go, sometimes you just hear them called LTACs. Acute rehab hospitals, skilled nursing facilities, and then some kind of other random places you may or may not, again, have thought of going. So I'm going to kick it off just with hospitals. So in order to reach probably the most amount of people, there are some departments that you might not, have thought about going to. These first two bullets, community outreach and education and wellness departments, are going to be in your larger academic hospitals, like might be called tertiary hospitals. There might be, big health systems. They might have actual departments called a community outreach department or an education and wellness department. Those departments are responsible for several things. They might be responsible for educating the whole hospital staff. So anyone from nurses, to social workers, to physical therapists, but also the people that are in housekeeping, the people that work security, anybody who is in the hospital, they tend to have this educational department that will do these kinds of programmings to help them ensure they have a really educated staff. Because really, in your hospital, staff there, anyone could touch a patient or a family member coming in. So they like to educate their staff in general. They also might provide outreach into their local community and provide educational workshops to just citizens, residents, in their surrounding area. So that's a great place to start if you want to hit both people inside the hospital as well as people that might live in the surrounding area. These departments coordinate live in services, live presentations, as well as webinars kind of like this. So look for a community outreach department. Another word for that department could be education and wellness. I've seen them both. A lot of times they're the exact same kind of office. They're usually staffed by people that might have public health degrees. They could be staffed by nurses that want to be out of the patient care and want to come in and just do education. So those are two really good kinds of departments to look for. Then after that, almost every hospital, regardless of the size or location, is going to have a nursing education department. Because the nurses, as your hands-on caregivers, need continual education. They want to stay on top of their field. They need to complete so many continuing education kind of classes. So teaching them about GBS, about the foundation, about CIDP, about any of these things would fit really well into a nurse's continuing education. So look for a nursing education department. Then medical education happens in those teaching hospitals, in those academic hospitals that are training our future doctors. They're training interns, which are first-year residents that could be just general medical residents, or they could be residents that are in a particular specialization, or fellows. Fellows are doctors that have gone through a regular residency program, and they want to keep going and get an even more specialization. So the medical education department of these hospitals responsible for overseeing all those kinds of doctors. And again, they will bring in outside groups to help in that education, to help give them a real well-rounded training, as part of their hospital. So when you're trying to find these different departments, they may not be listed on hospital websites. Something that I've seen that a lot of healthcare systems recently have done the last few years is they've tried to simplify their websites. They've taken a lot of department phone numbers down. They are just trying to clean up what these websites look like. So it doesn't always make it easy for us to kind of find things. So what I tell you, find that main number. There's probably one number on almost every part of their website, general hospital number, ask for the operator, and then you'd ask for any of these kinds of departments. Say, do you have a community outreach office? Can I have the nursing education office? They will transfer you, and then hopefully that will get you moving and into onto where you want to be. Next place to focus on is that direct patient care areas, which are the nursing units of the hospitals. Depending on the size of the hospital, it may or may not have all these kinds of units. So if it's a larger hospital, they may have a whole nursing unit, a whole floor dedicated just for neurology patients, patients with GBS, with CIDP. Maybe they've had strokes, maybe they've had spinal cord injuries, any of those kinds of things. So that would be really an ideal place to go in, try to do education for those nursing staffs, for those patient care assistants, the ones that are assisting the nursing staff. Great place to start if you're near a large hospital. ICUs, intensive care units, are another good place, particularly GBS. A lot of our those patients have gone through intensive care units. Even so, these units may also have different names. They could go by, I've seen, it could just be a medical or a MICU, M-I-C-U intensive care unit. Some of them can be labeled as step-down units. There could be different kinds. So but basically look for that ICU terminology. Emergency departments, basically the front door kind of the hospital, another great place. It's where a lot of times the initial diagnosis can happen, and where we know a quick diagnosis can lead to quick treatment and hopefully the best outcomes for patients. So training those emergency room doctors and nurses and fellows and anyone there with really what these conditions are and what the foundation is to be able to help these patients, it's going to be so valuable. And then your general floors of the hospital, which they call medical surgical units. They would be, after an intensive care unit stay where a patient would end up one step closer to discharge. Another wonderful place, to present this information to. For all these nursing units, they're all led, person in charge is called a nurse manager. That's who you want to really get to. But actually finding them and figuring out who that person is might be difficult. So if the hospital, they have a web page and they do list the nursing units on there with phone numbers, try that first. If not, again, go through the main number, call the hospital operator, ask to be transferred to the intensive care unit, ask to be transferred to the emergency department, whatever it takes. Who answers that phone is probably a nursing unit clerk. You want to be very nice to that person. They're really your gateway, you know, to be able to doing anything else. Ask them if who the nurse manager is. Can you speak to them? Can you leave them a message? Tell them, you know, you're from a not-for-profit foundation that has information, you know, about you know, this wonderful organization to support patients. And then hopefully, you know, that will get you in the door. Other departments and hospitals that would be really great places to know about the foundation. Your case management could also be called a social work department, could also be called care management. They're known by several different names. This is where the discharge planning happens in hospitals, staffed by social workers, sometimes by nurses, sometimes a combination of the two. Almost every department, every hospital will have this kind of department. May or may not be listed on the hospital website, could be under patient care on the website, could be under support services, could just be under discharge, something like, look for all those kinds of words. And then also obviously the rehabilitation departments of these hospitals. They may have inpatient as well as outpatient departments. If it's a larger hospital, they probably have 2 or 3, maybe even 3 different areas of departments for this service. This is where you're going to find your physical therapist, your occupational therapist, your speech therapist, maybe recreational aides, all the people that, you know, really you want to get to. You want to be able to, you know, let them know about the wonderful things the foundation can offer, because they can then right away, you know, give our information to patients so they can benefit sooner than later from what we have to offer. All right, after hospitals, next, another type of hospital, but a different animal. So long-term acute care hospitals, you might have heard LTAC, really just the acronym for long-term acute care hospitals. Came about 15 to 20 years ago for your acute patient still has a lot going on, maybe on a ventilator, maybe needs continuous IVs, maybe has a feeding tube, several other lines in, has lots of care needs. Patients these days don't stay in those general hospitals as long as they used to. A lot of times they're looking to get transferred on to one of these kinds of facilities. Some names of some national brands of LTACs are, you might hear of, are Kindred Healthcare is one kind. PAM Health is another brand of LTACs. These hospitals function pretty similar to a general hospital. However, they don't have emergency rooms. Patients don't, you know, just show up there for care. They get transferred from other hospitals. So a lot of GBS patients do end up in LTACs. It is a stopping ground for a lot of them. So they may be very familiar with actually taking care of our types of patients. You know, look for nursing education departments, just like the general hospital, and your rehabilitation departments, where the PTOT, where those therapists are. 2 great departments to reach out to present our information. And then after long-term acute care hospitals, the next step for a lot of patients is to go to an acute rehab hospital, or you might have heard it called an inpatient hospital. So this is where most of the rehabilitation happens for patients. They can be independently owned. Some of the larger ones you might have heard of. Kessler is in New Jersey. Spalding Hospitals in Boston. Shirley Ryan is in Chicago. These are huge rehab hospitals. Many of them have all of their own types of education departments. They may have outreach departments like general hospitals do. There are also nationwide another brand called Encompass. You might have heard in different places around the United States. Some academic larger hospital systems also own their own acute rehab. For instance, California Rehab Institute is part of the Cedars-Sinai system in California. So if you're on a general hospital's website, you can always check and see, do they have their own acute or inpatient rehab hospital? A great way to start is to look at these hospitals for either, again, nursing education or their rehab department. They'll always have, again, the primary people here are the therapists. So find that rehab department. They will probably be loving, any kind of information that we can provide them. The next in your level of care continuum after an acute rehab hospital that a patient could go to is a skilled nursing facility. So people sometimes call them SNFs, NFFs. These are nursing homes. Patients can stay for a short amount of time. Medicare pays for up to 100 days. Sometimes people stay, though, for long-term care. They may end up, months, years, depending on what they need. For a skilled nursing facility, I would probably call the main number and go straight asking for the director of the facility to get you in the door in a skilled nursing facility. They may tell you, oh, well, let's do it for the rehab department, or it could be a nurse educator, could be one RN, whose responsibility is to provide keeping updated on education. So there might be a nurse educator within the skilled nursing facility. So those are people to look out for to get the information to. Doctor's offices. Might be, a little less intimidating maybe than going to, to a large facility, or maybe you want to start, with your own doctor, your own primary care doctor. You feel comfortable there already, get warmed up, feel things out there. So a primary care office, primary care providers, they might be either internal medicine doctors, could be part of a family practice. Either one of those, I think, are good starting points to get this information to. Every doctor's office either has what's called an office manager or a practice manager. When you call, or if you want to, show up, or you're at your own appointment, say, can I talk to them? I have some information about this foundation. I think, you may really want to know about it. So might get, help to get you in the door there. Obviously, a neurologist, they might be part of a freestanding physician practice on their own. That means the doctors own themselves. They have an independent practice. Or they could be part of a hospital system, healthcare system, where that healthcare system owns the practice. So sometimes those offices are a little bit harder to find. So you may have to, again, go back to that health system or hospital's website to find out where those neurology practices are. Do they have an office in the hospital itself? Do they have maybe a medical arts building where their practice is, or do they have a whole separate other office location, away from the hospital? Either way, they should, again, have an office or a practice manager who would be your contact to go find. Emergency room doctors. So yeah, you see them in the emergency room, but usually they also have an office. They might be employed by the hospital. They might own themselves, or they could be part of a larger physician practice group. You don't necessarily have to know that. How I've always gotten a hold of emergency room doctors before, if I couldn't just page or text them, is I just call the emergency department of the hospital and I asked, what's the office phone number for the emergency room doctors? They do have an office. They may not go there very often, but they have an office where they have a practice manager who helps to coordinate things for them. And that's how you would get in the door to see those doctors. So some other settings that might be great that, could just be an easy, walk by or walk in. Outpatient rehabilitation sites, those outpatient places where patients go for their PT/OT speech therapy. They could be independently owned. They could be part of a franchise. They could be part of a larger health system. Either way, those pretty much have almost, kind of open door policies. So I would, say you could probably just stop by without appointment and talk to someone and let them know, what great information that you have for them. All right, so what do you say? What to say and offer? So I would honestly just start whatever you feel most comfortable with doing. If you're comfortable walking in and out of hospitals, talking to doctors, you don't feel intimidated by any of that at all, yeah, go for it. But if or you want to start with your own doctor, your own neurologist, whatever you feel most comfortable and confident doing, that's what you should start with. If you just want to stop by and drop off some literature that Maureen's going to talk about later, drop off materials, fantastic. Ask, say, how many people work at your practice? What can I bring? How much stuff, can you hand out for me? Fantastic. You may want to branch out a little bit more and say, well, can I meet with your office manager? Can I meet with, the director, of the nursing home, just for a one-on-one? Doesn't have to be a big group. Can I meet with them? Tell them a little bit of the story about the foundation, a little bit about our conditions, bring some materials with you, while you're there. Say, hey, can you, just disseminate these out to your staff? That might be, sometimes it's much easier just to do it kind of one-on-one rather than, bringing a whole group of people together. Yeah. But if you do get lucky that you can do that, offer to do an in-service. Say, I'd love to meet with all of your doctors in the group. Or all the physical therapists. Can I do a little presentation over their lunch hour? Can I do it, a separate time? Do you have a time when you can I can provide education? Tell a story, tell your experience, present the information about our conditions, what the foundation has to offer. Handouts are fantastic. When I used to work at a hospital, sometimes I wouldn't honestly remember everything they said if I'm eating my lunch and going through, but if I had some handouts and some brochures that I could refer back to, that's what I would file and that's what I would keep and that's what I would use to be able to give to my patients later on. Anything that was kind of left behind. That's what was very helpful for me. And now I think Maureen is going to go into some more details about those things that I talked about, things that you can use when you are meeting with these healthcare professionals.
Exactly. Amy, thank you so much. That was amazing. And I just want to remind everyone, this is being recorded. So although you probably were taking a lot of notes, this is all being recorded and it'll be available on our website. So you can go back and look at all those great tips that Amy gave to get to the right person. And also you can see there's so many different ways, different facilities to go to and different ways to get your foot in the door. But once you get in the door, we actually make it even simple for you at that point. So if you are comfortable just talking about this program to your doctors, sure, you can go ahead and say what you want to say and, in any way you'd like to say it. But we do have scripts available for you. So there's a script if you want to just stop by and drop off a Be the Bridge brochure. You can follow a short script on how to explain the program. There's a script if you actually end up doing a workshop or an in-service that'll take you through a longer, a PowerPoint and a longer description of the Be the Bridge program. So we have support for you really every step of the way, but it all starts with this brochure. And at the end of the webinar, we're going to give you a link to sign up for these brochures. You bring them to your doctor or the healthcare professional, and the whole program, which is really all the programs and services available at the foundation, is described in the program, in the pamphlet. And on the back, the doctor can go into the QR code here and come into our system and be in our database and we'll be communicating with them on a regular basis. But if you get a workshop or an in-service situation, we have a templated PowerPoint for you. So we're really trying to make this as easy as possible. And so we want to show you in this presentation, it's kind of a PowerPoint within a PowerPoint, but we want to show you what that would look like. So if you're in front of a room full of nurses or physical therapists, you can pull up the PowerPoint. This would be page 1 of it, and it simply explains the Be the Bridge program. It's for healthcare professionals who would like to bridge ongoing care and resources to their patients with GBS, CIDP, or MMN. And then the next page of the PowerPoint, Amy, if you can just move it forward, explains why would you want to bridge your patients to the foundation. And it gives all of the different services and programs that are available for your patients, such as free educational booklets, a speaker series, which is our webinars and our coffee chats, and our monthly support coffee chats for patients and caregivers. We also have a health navigator, and Amy is on the call with us today, who will do one-on-one consults with you. And we have virtual in-person community support. We have of course, our biennial symposiums, our local chapter meetings. We have local volunteers. So there are many, many, many reasons that your healthcare professionals would want to bridge their future GBS, CIDP, MMN patients to the foundation. This is page 3 of the PowerPoint, which explains what we have specifically for healthcare professionals. And we do have a physician-to-physician consult service with our global medical advisors. So if they want to speak to a real expert in GBS, CIDP, MMN, or any of the variants, we put them on either an email chain or a phone call together, and they can consult with one of our global medical advisors. We also have guidelines for treatment and diagnosis in multiple languages. And we have a research grant program and a Centers of Excellence program that they can apply for to get research funding or become deemed one of our Centers of Excellence. So that's page 3 of the PowerPoint. And then moving on. So on page 4, we actually have a video of a physical therapist who is part of our community. She's a volunteer for our community. She is a manager at Bryn Mawr Rehab, which is right outside Philadelphia. And she has referred multiple people to the foundation and has had really good results. So within your presentation, you can even show this video of Maria Harris explaining why she is so passionate about referring her patients to the foundation. So Amy, if you can just play that video, I think it'll work.
My name is Maria Harris, and I'm a physical therapist at an inpatient rehab facility outside of Philadelphia. I roughly see anywhere from 2 to 3 patients a month with the diagnoses of GBS and CIDP, and most recently, we've been averaging about 1 patient a month with Miller-Fisher. For all of these patients, I refer to them to the GBS, CIDP, MMN Foundation International. I am a huge proponent of this organization and the foundation for all of the resources that they do and the community that they have built for these patients. Every single one of my patients who has joined the foundation always comes back and thanks me for introducing to them. I have never been a part of a foundation who is so patient-centered and really does an amazing job getting as much information to the patients as possible.
So again, that just reiterates to anyone that you're trying to explain to, the importance of connecting with the foundation for their patients. And then at the end of the PowerPoint that you would show, there's a QR code. The doctors can the nurses, whoever you're with, can hold up their phones and sign up right there for the program and be a part of our community. And then, hopefully no one will walk this journey alone. That's kind of the mission of all of it.
Mm-hmm. Got it.
Yep. And okay, so next steps. So next steps for you, Meg is going to put a link into the chat that'll link you to the Volunteer Be the Bridge portal. And so you just fill out a very brief form and you will actually receive these brochures in the mail. And then you'll get a response email that has a link to this PowerPoint that we just showed you. And it has a link to the 2 scripts. The one script, if you just want to drop by, with your brochure, and the other script is if you actually are going to give a workshop or a presentation, you can follow that script right along. You can read from the script. I'm sure the doctors would understand, or you can just speak it in your own words. Many of our volunteers and patients that join this program are so passionate about explaining their story and explaining the importance of the foundation to their healthcare providers that they don't need a script. They're just speaking from the heart, and the healthcare providers really understand that, and they do tend to want to join the program and learn more. So one of those passionate patients, as I had introduced before, is Tom Rawcliffe to my left. And Tom, I'm going to turn the microphone over to you. If you could tell us why you're passionate about this program, how you found out about the foundation, and how you've benefited from the foundation, that would be fantastic.
Hi, Maureen, and thank you very much for inviting me to this.
Yep.
Is everybody hearing?
Yes.
So,
Yep.
the remarkableness of my journey is the unremarkability of that journey, because the first neurologist that I actually saw was actually a member of the medical board for the foundation. So I was extremely lucky because I'd never heard of CIDP. I had no idea what was going on. All I knew is that I was having trouble walking. And because of that early involvement, I believe that really attributed to my successful recovery. Not only am I successful from just a recovery standpoint, but I'm also in remission, and I no longer receive treatment for the disease. And that was all because of three factors. One, the foundation is very knowledgeable. With CIDP, there's no one side to it. And so everybody's experience is different. And the foundation, the medical board especially, brought all of those people together to advise me and show me the best way through it, which adds me to number two, the passion within which the members only, not just the medical board, but the people that we were speaking with here, who actually were committed to my success, and they're committed to everyone's success. They want people to survive. No one should go through this journey alone. It is a rare disease, but it's only rare, as they say, until it's you. And like I said, I started this journey not knowing anything about the disease. My doctor, my regular primary now, we spend probably 10 minutes each visit where he asks me what I've learned new about it. The other point that I think was also important is that I'm 40 minutes away from the foundation's international headquarters, and I was at one of their centers of excellence. I still see several other doctors who are still on the foundation global advisory board. It's just impressive how so many doctors are so dedicated to help one individual. And I'll leave it at that.
Yeah. Yeah. No, it's very true. And I think, you know, the more healthcare professionals really learn about the foundation, they get just as committed. You know, they get very inspired, and they hear the feedback from their patients, and it kind of just organically grows like that. So thank you, Tom, so much. We're so glad you joined us today. We're so glad you joined us. So I think we do have some questions that came in from the audience. I believe they're going over to you, Amy, if you want to just roll them out. And we'll see if we can answer them. Yeah.
Absolutely. So someone's asking, she said, I feel like neurologists, med-surg units, and ICU staff already know about GBS and CIDP. At least that was my experience. Is it worth contacting them?
Yeah.
I would still say yes. Yeah. And they may know about how to diagnose and treat those disorders, but they may not know about all the services that the foundation has to offer. Or they may know of us, but not as many about the details. Or maybe they don't know about the doctor-to-doctor consult service, or maybe they don't, know about how many volunteers we have, or, any of the other kind of really amazing, resources that the sooner they get, patients know about them, the better. So I would absolutely, that's me. That's what I definitely think.
Yeah. No, absolutely. And you're right. Yeah, no, you're right. This whole program is about raising awareness of the foundation services. So although they do know about the condition, as Amy said, they definitely don't know about all of the programs that we have available. A lot of times people will associate foundations with research or supporting research and funding research, which we actually do. But in addition to that, we have so many support programs for patients. They can meet, if they contact us, they can meet someone that has their very rare condition that day. So it's really life-changing. So yes, the answer is yes. It's very important to contact them as well.
Yeah. Another question we have, how long before CEUs are available? Well, I am a registered nurse. That would be very important for me to earn. Well,
yeah,
it is a bit of a process to become an accredited provider for licensed healthcare professionals. So we are at the beginning stages of looking into that, Christine. I do hope that that's something that is going to be offered. Pay attention to our website.
Yeah.
Definitely something, you know, that we would push out there. I'm sure, like through our maybe through our newsletter or through emails, you know, once that's something that can be available.
Yeah. Stay tuned.
Yeah. Another question, will you remind us where we can find the scripts and the PowerPoint to use?
Yes. So
Maureen? Yeah.
once you sign up, so if you sign up in the link, and I think she may have put it in, yes, if you go to the link and bookmark the link, actually that Meg put into the chat, you're going to fill out a short form. You're going to get these in the mail, these brochures, and then you will also get an email from us thanking you for joining and giving you a link to both the PowerPoint and the scripts. Okay, so that's your best way to reach them. Please feel free. If anything gets confusing, we know it's a lot of information coming at you. So if anything gets confusing, feel free to call the office. Any one of us will jump on a call and we can explain how to find everything.
Oh yeah, definitely.
Yeah.
Another question is, what if I don't have a computer? Yeah, good question. So as Maureen said, well, we'll have these items, yes, so you can probably download them if you don't have a computer, but if you do have a computer, if you don't, we'll mail them to you. You know, yep, absolutely. We'll mail them to you. Yep, exactly. So just call us. We'll make sure you get them.
Yeah.
Also, can I give a virtual presentation? Absolutely. And sometimes, you know, a virtual presentation is a little bit easier to get in the door than a live presentation. So yeah, think about doing that. Sometimes they like virtual presentations, especially in hot places where they're really, really busy because they're doing two or three things at the same time. If they, you know, eating their lunch or, you know, finishing notes while they're also listening, and, you know, it can be definitely a way to, you know, still get the information across. So yeah, don't think that, you know, everything has to be in person. Right. Doing it, you know, as a virtual can definitely work too.
Yeah. And that's where that PowerPoint comes into. It's really easy to pop it up on your screen on a Zoom, just kind of follow along, explain it. They have the QR code at the end, they can sign right up. So yeah, virtual is actually a really good way to go.
There you go. I'm not a healthcare provider. How can I get a healthcare provider to talk to me? I like this question a lot. So, but if you're a patient or you're a caregiver, you've had the experience, you've had the direct experience. There's a big push right now for patients to be their own advocates. This is how you can be your own advocate. So I think more now than ever, they want to hear the patient's voice. They want to hear from patients' experiences, and be strong, you know, be assertive, be confident, you know, in yourself, you know, that you know this information and that you feel that this is worthwhile. Nothing wrong with that, you know, nothing wrong at all with not having credentials by your name. You are still the expert in this. So still go out there and do it. We're behind you.
Yeah, exactly. We're supporting you, and they'll feel your passion too. It really is about making that connection with and speak to them about how you have benefited from the foundation. You know, there's all the benefits at the foundation. You can hand out the brochures, you can follow the PowerPoint, but make sure you tell them, I believe in this foundation because it helped me XYZ, however we've helped you. All right. Anything else?
Yeah. That's all the questions that I have so far.
All right.
Anybody else? Anything else we can answer for anyone, or anyone just have any comments? Oh, it might be another one.
See one popping up.
So, Chelsea, yeah, we're not going to be answering any related questions. This is just about Be the Bridge information. For right now.
Yeah, you feel free to go to our contact page on our website. You can submit an inquiry there, and we will try to get you to the right person and get the right information to you if it's outside Be the Bridge right now. Oh, we got another one. I think we have another one popped up.
Yeah. Anyone had any success with recruiting caregivers to join their local walk and roll events?
Another good question. Not sure that this is the team that could answer that, but many caregivers get involved in our awareness programs and our fundraising programs in addition to patients. So There are caregivers that do run walk and roll programs. Usually it's alongside their patient with the patient. But certainly caregivers can be the bridge ambassador. And
Right.
certainly caregivers can go out with you or for you and speak to the local medical community for sure.
Absolutely. Absolutely. I think caregivers are sometimes even just, the best ones to do it.
Exactly.
Yeah.
They may be a little bit more mobile, but they certainly know your situation. And we also have a lot of programs for caregivers. So we have a lot of support. We have coffee chats for caregivers. We have a whole new caregiver portal. Potentially Meg can pop that in the chat. But there's a lot of programs for caregivers too, so they can speak to medical professionals from their own perspective of how the foundation has actually benefited the family unit and the caregivers as well as the patient.
Yep.
So, all right.
I think that's it for.
Well, I think that might be it for today. Oh, one more minute. Maybe that is the caregiver portal. Let's just, I'll pop this. This is a long one. Let's see.
Yeah.
It was difficult. Let's see if we can get to a question here.
Well, I think the bottom line is how do you get their attention?
How do you get their attention?
Yeah. Yeah. Well,
so yeah, bang on the door. Really. All of the tips that Amy gave you, start making phone calls, stop by if it's local. If you have gone to these facilities, they're probably more likely to speak to you if you know these doctors, if they're your own, have been in your own team of caregivers. That's probably a better start with people that know you. Anything else on that, Amy? Any other tips?
Yeah, I just remember, if you're a parent, a patient or a caregiver, you still are an expert.
Yeah.
You've been through this. You have, just as much say in this as as those healthcare providers. Don't back down.
And sometimes they're busy. So you might have a day where they can't see you, can't talk to you, can't make an appointment. You try again. Just keep trying again and think far and wide. The psychologists, infusion centers, any kind of medical professional that has touched your situation in the whole journey would be appropriate to go and tell them about the foundation.
Got it.
And they're going to likely someday have another GBS, CIDP, or MMN patient that could really use the support of the foundation. So that's the whole idea, that they know that we exist.
Yep. How soon can I get materials once ordered?
Depends on where in the world you live, to be honest with you. In the US, it's been probably, I'm going to say, within a week to 2 weeks. We try to send them out weekly. We collect whoever signed up for the program and we try to deploy them that same week. Internationally, we've seen it taking up to a month to 6 weeks, depending again on where you live. We do have Be the Bridge translated in Spanish. So we are working on some other translations now. So that is available as well. But if you are in an English-speaking area, you can certainly are welcome to the English-speaking brochures as well. It's just that it's not, it takes a while to get to other parts of the world.
And if you have a date of a presentation that and we can help to get things to you sooner, just call and let us know and we will do our best.
Exactly.
To help you out.
We could also email, I should say that. We can email them we can email the file. You can get them locally printed. We also have a flyer available. So it's an 8.5 by 11 flyer in case you don't have time to wait for the brochures or can't get brochures printed, but you can, let's say, print an 8.5 by 11 flyer off on a home printer. We have that available as well. And yeah, just give us a call. We can brainstorm different ways to support you through it as well.
Yep. I think we got them all.
All right.
Yeah.
We got them all. All right. So. Awesome. Excellent. Well, thank you so much to everybody. Thank you, Tom, for joining us today.
Thank you, Tom.
Yeah.
My pleasure.
Yeah, that was great. Thank you, everyone. We really appreciate you coming on the call. You are going to change the lives of so many people down the road. And thank you for joining us in our mission to really make sure that nobody walks this journey alone. But as I said, please feel free to call us, go sign up for your brochures today, and we hope to see you again very soon.
Thanks, everybody.
Have a good day.